who weren't able to attend today. And any other individuals who were unable to attend today will be able to view the presentation as well. So why don't we jump into the agenda we have for today? So in terms of the presentation, I would like to spend just maybe 5 minutes giving a quick overview of the MT transformation project. Essentially, how did we get here? What was our approach? After that, I'll hand it over to Kiara to spend some time talking to you about the changes within the benefit schedule and introduce a new document that we've called the Medical Transportation User Guide, outlining its uses and why we feel it's a great document for PT clerks. And then, as I mentioned, setting some time aside at the end, specifically for questions that you guys might have. So with that, I'll jump right in. For perspective, health benefits transformation has been one of our major focuses across the department since 2015. I'm kind of jumping into the middle with our pharmacy changes, but going back to 2017, that was kind of our first major transformation within the benefit plan. That's where we moved the drug benefits away from NIHB adjudication and brought them here to BC through a partnership with PharmaCare. So the drug plan is processed and delivered through a partnership with PharmaCare and to a small extent with Pacific Blue Cross as well for our clients that live near borders, the Yukon or Alberta border. We also have spent quite a bit of time and energy on a transformation of the dental, vision, and medical supplies and equipment benefits in 2019. And that came as a result of significant engagement across the province. We spent about a year receiving a considerable amount of feedback in terms of the changes that our clients would like to see within the plan. And then through a partnership with Pacific Blue Cross, was able to implement many of those changes to make the plan more accessible and just a bit more transparent as well. Kind of brings us to the medical transportation program transformation, which we started in 2021. Also we led into this transformation with a significant amount of engagement as well. So Jennifer Smith and team partnered with the FNHDA to deliver engagement sessions across the province, again, with the goal of understanding where the pain points or the parts of the program that were not working and inform policy change and other streams of work related to modernizing and transforming the health benefit, or sorry, the medical transportation benefits specifically. So the MT transformation project is divided into 5 streams. We have a policy stream, a community capacity stream, bringing services closer to home, and an IT system transformation stream as well. It is a multi-year transformation project. Again, I mentioned we started in about 2020, 2021, and it is slated to go through 2024, 2025 in terms of implementation of changes. The vision of this transformation is to support First Nations clients in their health and wellness journeys by improving access to health services that are outside of their community of residence. We'll speak a little bit in the next slide about how we've started doing that, specifically from the policy stream. So I mentioned that there were engagement sessions that were co-hosted by FNHA and the FNHDA. Again, significant amount of feedback collected through the engagement sessions. We have hundreds of lines of feedback that has been collected. And we have started implementing some of those updates. So just going back to 2022, we took some of the feedback around reducing the administrative burden on PT clerks and implemented that into the benefit schedule by reducing the number of items that required exception requests. So moving items out of exceptions into regular benefits, where we saw high approval ratios for exception requests. So the things that were routinely being approved, we moved them out of exceptions and into regular benefits. We updated the reasonable and customary rates for hotel stays in both Vancouver and Victoria. And we also engaged in a restructuring of the document, the MT benefit schedule, really with the goal of improving readability and the flow of the document overall. So jumping to the more recent version, this is changes that were implemented in April of 2023. We've done some work to clarify the closest appropriate provider policy. And all of the changes that I'm mentioning for April 2023 will go into a lot more detail in the subsequent slides. But just at a high level, we've also updated the escort while client in hospital exception requirements. And again, we've developed a new guide, the MT user guide, which is really aimed at PT clerks and supporting their ability to adjudicate the benefit. So something that supports the process and the execution of the benefit, which works in addition to the training that's already provided and the policy document, the benefit schedule that we already have in place. So with that, I would like to hand it over to Kiera to get into some more of the specifics of the actual benefit schedule changes. So over to you, please, Kiera.
Thank you very much, Atma, and hello, everyone again. So first off, I'm going to be talking to you all about the recent updates that have been made to the MT benefit schedule, which is essentially MT's policy document. This document is available on the FNHA website under the MT tab. And as you can see here, we've added a beautiful new cover page to the most recent version that went live on the 17th of April. So this here is exactly what the front of the document looks like when you access it online. So a bit of background. So most of you are already very familiar with the MT benefit schedule, but just for a little bit of context, the benefit schedule defines the policies and the benefits that support patient travel to and from medical care located outside the client's community of residence. So the MT benefit schedule provides details on the criteria for coverage, eligible travel, and also the most up-to-date rates for mileage, meals, and appropriate rates for accommodations. So seeing as one of the 5 work streams of the MT transformation project is in fact policy transformation, this document was revised and updated again in April of this year, just to further incorporate any suggested changes or any feedback to those areas of the policy that maybe, required a bit more attention, clarity, or detail. So with that, here is a brief summary of just the different types of changes that have been incorporated based on community's feedback. So first off, we have the layout or the structural changes where certain sections or policies were moved, kind of shuffled around just for better readability and organization, just to improve, the overall flow of the document. Next up, we have the actual policy changes, which are the specific changes that were made to the MT benefit itself. I will go into further detail, obviously, in the next couple of slides, but certain policies or processes have in fact been updated. And there's also been the addition of some brand new sections within the document, which again, I will be talking about in more detail. And lastly, we have the language changes, which were made to hopefully eliminate any potential confusion and just provide more clarity to various areas of the MT benefit schedule. So moving on, just to provide a bit more detail on those specific changes that I just mentioned. And the layout changes were made to aim at, improving the overall readability and flow of the document. So for example, all the sections, all the different sections that are related to escort coverage throughout the document have now been grouped together under section 3.8. And there's also been some the addition of some new subsections under section 3.8 for escorts. So those 3 new sections are requests for 2 escorts, which basically outlines the fact that such requests do need to be submitted as an exception and, just some of the considerations for these types of requests. We've also added a section for coverage for escort travel, which essentially just details the different types of transportation and the meal and accommodation benefits that are available to escorts when eligible. And then also accommodation for escorts while clients are in hospital. So this was added to explain when coverage may be eligible and also to detail the different types of coverage available to escorts when a client is admitted. As well as the escort section, we've also incorporated the details surrounding traveling providers into the closest appropriate provider section, again, just for better organization. Okay. So, next slide, please, Anna. So next up, we have our actual policy changes, which I'm sure everyone's very excited to hear about. So jumping right in, there has been an entire section surrounding the closest appropriate provider policy added. So this is always a major topic of conversation, both with clients and with benefit administrators. So we're really hoping that by adding a definition and, some considerations under this section, it will allow for more transparency on our end, and will just really show how these requests are adjudicated. Within the close appropriate provider section, also a very important consideration has been added for exception requests, and that's the aspect surrounding culturally safe providers. So for example, if a client were to experience a culturally unsafe event with a healthcare professional that has a knock-on effect on their travel, they must submit a report to FNHA's quality team, which MTOps can then reference if a client requires or requests travel rather to a further provider. So the information surrounding the event that has been submitted to the quality team will definitely be kept confidential to quality. However, there's now a pathway that's been created between MTOps and the quality team that allows MT to simply check whether a report has been filed or not. There have also been some changes made to the adjudication process for clients that require an escort for translation reasons. So if a client faces a language barrier, PT clerks can now determine that without having to submit the request to FNHA as an exception for approval. As well as that, some details have been added under the escort while client in hospital section to explain that coverage can now be provided for an escort that needs to assist a client home post-discharge. So when an escort is at home in community and the client traveled without an escort, the escort can go to essentially kind of pick them up and assist them in their travel home, again, without an exception being required now. So this really applies to those clients that have been medevaced or maybe admitted on an emergency basis and just requires that assistance at the end of their trip. And again, similar to the language situation above, this can now be provided without an exception. Lastly, on this slide, the escort while client and hospital requests that require an exception has changed from 3 to 5 days. So previously, anytime an escort was requested when a client was admitted to hospital for over 3 days meant that an exception needed to be submitted to FNHA. So this time frame has now been adjusted. It is now increased to 5 days, which means that an exception will only be necessary if a client is admitted for more than 5 days while on travel. To be honest, this last point here kind of speaks mostly to those non-emergent hospital admissions that typically PT clerks would be aware of ahead of time.
Sorry to interrupt you there. We do have a question from our audience here. So Christine is asking, what do you consider a language barrier?
I may let Paul answer that question. I mean, yes, I'm going to pass that over to Paul.
Well, that's traditionally been considered where someone English is their second language, and they're more comfortable in their mother tongue.
Thank you, Paul. So then on to the next slide, please, Atma. So next on to the language updates that were made to the benefit schedule. So certain language throughout the document has also been updated, and again, this aims at improving the overall readability of the document. I mean, As you all know, this is available on our website for clients also. So it's really important that the policies and the language is just as clear as possible. For example, language has now been added to the long-term stay section, just to clarify that clients do have a responsibility to potentially arrange for alternate funding or potentially consider relocation during a transition period. This specifically is in reference to those clients that are needing to stay, you know, in an urban center for medical care for an extended period of time. The program does provide assistance for up to 3 months on a transitional basis. So this new language just iterates the fact that if a client may need to stay beyond that 3-month period, they may need to seek other sources of funding or consider relocation. Other sources of funding, a very good example, is through the ministry. As well as that, the language surrounding compassionate travel for an escort under the exclusion section has also been updated. Here, we really wanted to speak more to the specific escort criteria and eliminate any confusion surrounding, you know, what may or may not be deemed compassionate travel. And lastly, a lot of new language has been added under the escort for clients in hospital section, specifically some considerations for approval, which of course is for transparency reasons. Some of the updates under this section do overlap with the policy changes I mentioned in the previous slide, but this section is far more detailed now, as we really just wanted to communicate these policies as clear as possible. I mean, as you all know, escort for clients in hospital is also just really one of those major topics of conversations.
We do have a follow-up to the language barrier question. And the question is, would you consider someone with a language disability under a language barrier?
So I'll defer to Paul. Yeah, Paul, if you don't mind.
I'm not sure exactly what that is, but we would review these situations on a case-by-case basis. I don't know what, yeah.
Christine, would it help if you were able to talk and ask Paul for clarification, or does that answer your question? Hang on a second. Christine, does that address your question for now? And you're able to talk.
Hello?
Hi, Christine. Yeah.
Hi, thanks. So what we're looking at is we do have clients in our community who have a language disability, meaning that they have difficulties with language comprehension, and they've had that diagnosed either, you know, in childhood or in adulthood. And so what they benefit from is often having like somebody come along with them to appointments so that they can help explain what's going on. Because if they go by themselves, they might struggle to actually come home with the information that they need. And so that's what we're thinking, is that if we have somebody who falls into that category where they actually have a disability, maybe qualify for disability status, would they be able to have an escort so that that person can help make sure that they come home with the proper information from their appointments?
Yeah, so that's not so much a language disability as a comprehension disability. And so that would, yeah, that would likely be an eligible benefit.
Thanks very much, Yogita. And just to make sure we get through the content in a timely way, Yogita, if you don't mind, let's hold the questions to the end, and then we can go through and
Sure. Thank you.
Okay, I think we're ready for the next slide, Alma. Thank you. So just to finish up on the benefit schedule portion of the slide deck, we just have a few other updates, which include the addition of a few new sections that haven't already been mentioned. So these sections are 3.3.5, air ambulance or medevac, which has been added to clarify that MT benefits are available in such situations. And also travel over 5 nights is a new section that has been created just to highlight the fact that an exception is required and when that exception should be submitted. So that rounds things up at the moment for the benefits schedule updates. But next up, I'm going to be introducing something that I am personally very excited to talk about, and that is our brand new and beautiful, now I may be a bit biased, but our beautiful new MT user guide, which also went live in April of this year alongside the benefit schedule updates. So the MT user guide is a brand new document, and unlike the MT benefit schedule, it's a process-oriented document that is aimed specifically at strengthening community capacity, which again is one of the 5 work streams of the MT transformation project. I will admit it's more of an attractive document in nature, as its purpose is to really guide you through the steps of assessing and arranging travel, rather than just kind of detailing the nitty-gritty policies of the MT benefit. The 2 documents, the user guide and the benefit schedule, are supplementary to each other, but the user guide is full of graphics and diagrams, useful tips, example situations, and we're really hoping that it's going to be a useful resource for you. For example, like someone who's new to the job, and I'm sure we can all maybe empathize with that, the benefit schedule can seem a little bit daunting. It is the policy document. The language is very formal and it needs to be very detailed. But this user guide comes hand in hand with the policy document and really just shows you how to apply the specific policies. I should also mention that the guide does align with the MT training sessions that Paul and team do host. And it's basically there just to act as a manual, possibly someone who's waiting for the next training session, maybe someone who needs a little refresher, but hopefully all of you folks find it very helpful, okay? So the overall structure of the guide has been broken down into 4 steps, which I'm sure you are all already familiar with. But step 1 is assessing the eligibility of the client who's actually submitting the request. Once you've obviously determined that the client is in fact eligible, and you should be the ones administering the benefits, so your community or your organization, then you need to assess if what they're actually requesting is eligible. So, for example, has the client provided you with all the necessary documentation? Is their potential escort request eligible? Are they traveling to the closest appropriate provider? Or, maybe is an exception required, etc., etc. So moving on from that, we have step 3, which involves making the actual arrangements. So in this section, we have details on all the various modes of transportation and, information on how to choose appropriate accommodations, how to book those accommodations. So again, this document is really focused on the how-tos when arranging travel. And last but not least, we have a section on reporting, which is the last step of any travel request. So this section talks about the actual reporting process itself and provides contact information for the funding arrangement team. So really just to reiterate, this document will truly, hopefully, walk you through the steps involved from the moment you receive that request from the client to the moment you're finished with it. So whether an exception had to be submitted or not, or whether you needed to make a hotel booking, it will really take you through that process from start to finish. And now here is a beautiful example of one of the flowcharts that's within the document. So this is one of the simpler flowcharts because obviously it's easier for me to go through with you now today. And this flowchart details the steps involved when determining a client's meal allowance eligibility and what type of meal allowance they should be receiving. So from the top of the chart, client is eligible for MT benefits and has submitted a request for travel. So at this point, you've already determined the client themselves are eligible to receive the benefits, and your community or organization are in fact the ones that are responsible for the client's travel. So the first question is, will the client be staying overnight, or is their travel same day and over 6 hours in duration? So this 6 hours time frame includes travel there, the appointment time, and travel back. If the answer is no, so if it is same day travel under 6 hours, you should also be asking the question, well, does this client have a medical condition, or potentially does their specific appointment require them to have meals? So a specific example of this would be if the client is diabetic. If the answer to that again is no, so the client does not require frequent meals due to a medical condition or the appointment, then they are not eligible for a meal allowance because it's a very short trip. If, however, the client does have a medical condition or the appointment does require them to have regular meals, then they would in fact be eligible for the daily rate. Jumping back up to the first question, if you were to answer yes to that, so if the travel is overnight or if it's same day over 6 hours, so you're answering yes. If it's same day over 6 hours, again, they're eligible for the daily rate. If their travel is overnight, you obviously will need to be asking, okay, well, how many nights are actually eligible for this trip? If it is 6 nights or less, they're eligible for the nightly rate. If it is 7 nights or more, they would be eligible for the weekly rate. So all of the current rates are, of course, located within the MT benefits schedule. And throughout the MT user guide, if you are using this electronically, there are links. So if you say, for example, even within this flow chart, if you were to click, see section 3.4 of the benefit schedule, that will then link you to the FNHA website, the benefit schedule there, and then that will detail the most up-to-date meal rates. Okay. So I think that brings my slides to an end, but I hope everyone is as excited about the user guide as I am. And I'm really, really hoping that people find it very useful, during their day-to-day tasks.
Thank you so much, Kiara. Before I let you go, do you mind just speaking a little bit to the colors that you're seeing? Because the colors are there for a specific reason. Do you mind just mentioning it to the folks?
Yes, of course. So these colors are the colors throughout the document. If we jump back a slide, actually, Atma.
If I can do that, 1 second. There we go.
So these are the colors that are used with the transformation team. And then obviously, if you're going through the document, there are specific color themes to kind of walk you through each step. And that really flows through the document and kind of just really creates better organization so that you know specifically what step you are at, whether it's, assessing client eligibility or the reporting section. So, yeah.
Yeah, so the colors correspond to sections within the document, and within this flow chart, the colors also kind of help direct you back to the section associated with that particular question. Thanks. Thanks very much, guys. Or thank you very much, Kiara. So keeping an eye on the time, I'll be quite brief. In the background, while we were doing some of the policy work, the MT project team is also actively working on an MT administrative system, the Kuhan system. That will be discussed in future meetings, but it's another work stream related to the IT transformation that's still underway. Just in terms of questions or information that are not covered in today's session, if you do have ongoing questions about a particular claim, please feel free to call us at our 855 number, the 855-550-5454, or transportation@fnha.ca, and that will connect you in with someone on Paul's team, so one of the assessors on Paul's team. As a reminder, we do have the opportunity, if there are other concerns that you'd like to discuss with us or with our engagement team, please feel free to reach out to Jennifer Smith. Her number is up here as well, 604-785-6955 for any engagement related questions or concerns that you might have. And then finally, if you're looking for any more information about the project itself and that transformation, the transformation work that we're still undertaking, more information can be gathered by reaching out to the MT project at fnha.ca. So with that, thank you very much for your attention, and I would love to open up the floor to questions. Please feel free to enter any questions you have in the Q&A box, and we'll spend some time answering any questions that you might have.
We have a question here that was, so where do we find copies of the guide and the policy? So I've answered the policy piece, but if one of the panelists can address how can our audience access the MT user guide? Thank you.
Sure, I can answer that one. So with the MT benefits schedule, that is a kind of a broad client-facing document. So it is posted on the MT webpage, fnha.ca/medical transportation, I believe is the URL. Paul, correct me if I'm wrong. But with the user guide, because it's more specifically focused on PT clerks and includes a couple documents that are not necessarily intended for broad distribution, please do reach out to us at the transportation@fnha.ca for request for the copies, and we can send a copy out to you digitally. We are working on printed versions of the document, the user guide document as well, and we should have printed copies relatively soon if you prefer to have a printed version than a digital version. But to get the user guide, please do reach out to us at transportation@fnha.ca.
Okay, so we've got Kimberly is saying well done on the user guide. So congrats, team.
Thank you, Kimberly.
We have a question from Kim Wilson. When will there be another MT training session?
I should probably answer that. We're intending to have a Zoom training session this month, near the end of the month. We haven't set a firm date yet. If you're interested in the training, please contact Mary Legg. Mary period Legg, Legge at fnha.ca. That's Mary, Mary period Legg, Legge at fnha.ca.
Christine has a question. Are we able to get a list of PT clerks that attended this meeting from the NTC area, so we know who's aware of these changes, so we can send updates? Christine, I do have a preliminary list of attendees, and I'll just work with my team to kind of get a final number here after this meeting is done. So yeah, we might be able to communicate that information to you. Rhonda is asking, is there a reporting guide or a reporting session for new PT clerks? So I'm not quite sure what that means. Rhonda, do you mind if I just promote you to speaking level, and then you can perhaps amplify on your question a little bit more? Go ahead, Rhonda.
Hello, I'm the health director for our health center, and we are newly taking over the patient travel part of our administration. So we have never done the end of year reporting. So I am asking if there is, I know I've talked to Mary, well, not talked, but emailed Mary about this, but will there be a session webinar on how to report at the end of the year?
Okay, so there's two different types of reporting that's required. One is the financial statements, the year-end financial statement, the audited financial statements, and those are just, developed or compiled by the auditor that you employ and forwarded to us. So the MT training logs are not required at the end of the year. They're required 3 times a year.
Okay,
And she is the person to go over that with you, and she has in the past and would happily do it for you folks, arrange a Zoom call webinar session specifically with you to go over how to report.
that's great. That would be very helpful. And who is that?
Oh, that's Mary Legg. That's the-
Okay. Thanks, Paul.
Kimberly, go ahead with your question. Kimberly, I think you had your hand up. You can ask the question. But in the meantime, Nadine is asking, is there any difference for communities with a full funding transfer? Again, I'm not sure if perhaps Nadine will want to speak to this a little bit more. Nadine, you can ask the question and perhaps amplify on this a little bit more.
Paul, is that terminology something that you're familiar with?
So I think what
Hi,
okay, let's let Nadine just,
sorry about that. We wanted to know about the full funding transfer. What is that exactly? Okay, just a minute, please. Hi, this is Tina. Sorry, we're on 2 different computers here. So Heshquin, we do have a full funding transfer. So I'm wondering if there's any difference with our rules with the medical travel program.
so there, every community in BC has a funding agreement of some type with FNHA for nursing services, home and community care, all that stuff. Now, with MT, not every single community has a funding agreement. There's 121 funding agreements. The stacked or the transfer, flexible, all that stuff. I don't understand the differences either. That's a funding arrangements thing, and it's more related to other matters. Everybody who has an agreement for medical transportation follows the same policy.
In terms of the question about difference, is it related to differences in policy or differences in reporting?
It's related to, again, you should have someone from funding arrangements. The point is, it's got nothing to do with medical transportation. It doesn't matter whether you have a stacked agreement or flexible, or I don't know, all the different types now. Everybody who has a medical transportation agreement is expected to follow the same policy and provide the same reporting.
Yeah, so I think in terms of I believe it's called flex or block funding. Those, to Paul's point, are differences on how the funds can be allocated, and the individual's best position to answer that is our funding arrangements team. So Nadine, maybe we can take down your contact information and get you connected in with one of the managers on that team. But in terms of the policy, to Paul's point, in terms of policy and reporting, the type of funding agreement you have does not affect the policies that you would adhere to. So that would be everything listed in the MT benefit schedule, and the reporting requirements would be listed in your program plan. And if you're not familiar with the program plan, again, the the folks in our funding arrangements team, probably the best suited to give you those details. So 2 things we can do. Nadine, we can probably take down your contact information and get you connected. Alternatively, if you'd like to email Paul and team at the transportation@fnha.ca, we're happy to follow up with you through either one of those avenues. Hopefully that gives a bit of sense on your answer, Nadine. If it's still unclear, please let us know. We do have a few more minutes allotted to question and answers. Folks, if there are any more questions, please do let us know. Feel free to enter your questions into the Q&A box.
You know what? I didn't have a chance to call them. Let me just call them now.
Jovita, are we getting any more questions in through either the chat or the Q&A?
No, we're not getting any more questions. Yeah, if anyone would like to directly address the panelists here, like I said, please raise your hand and I'll facilitate that. Oh, I think we have another question. So this question is by Darla. We have had patients out on long-term stay needing an escort. The issues that we had was that the escorts were changing out. Is that allowed, or do they have to stick to the same escort? Yeah, please, whoever would like to take this question.
I can answer, or Paul, would you rather answer this question?
Yeah, maybe I'll answer this question. So we fund an escort when clients in hospital. There's some criteria around that. It has to be submitted to us as a benefit exception. Now, the escort can change, but we're not paying multiple people to travel back and forth. We would fund one escort to come at the beginning of the hospitalization and return them when their coverage is ended. But we do not pay for shuffling escorts.
Okay. The next question is by Shelley. A client is unable to attend their appointment and has to reschedule, but used the funds. Can another be done? So can another be done before they are? Oh, so Shelley, I'm just going to ask you to maybe just frame this question a little bit more. So Shelley, if you don't mind just clarifying what the ask is here.
Paul, given what was typed into the Q&A box, do you think you're able to answer it?
Yeah, I didn't see what was typed, but
Client is unable to attend the appointment and has to reschedule, but has used the funds.
so, I mean, this would be reviewed on a case-by-case basis. Like when we schedule appointments, make arrangements, hotels and flights, the expectation, of course, is that you go to your appointment. That's the client's responsibility. So if they didn't go to their appointment, the question then becomes why? And we would review that to see if it was reasonable. You know, I don't understand how you don't go to the appointment, but you spend all the money. That would be something that we would want to determine. So for example, I guess, if we flew somebody into Vancouver for a specialist appointment, they go to the specialist appointment, find out that the specialist has been called away to an emergency, have confirmation of that from the provider, then yes, we would rearrange their appointment. If we schedule them to go for a specialist appointment in Vancouver and they fly out, they stay at the hotel, et cetera, and then they don't go to the appointment, then we would wonder why that was. And unless there was a very good reason, and I'm not sure what that would be, then we would not give them another money for that same trip.
So in Shelley's example, she specifically is asking, for example, their transportation vehicle is broken down before they arrived at their appointment. I think that kind of falls probably in the second category that you're mentioning.
Yeah, we would review that. We would want some confirmation, you know, et cetera, et cetera. So if the car breaks down, well, is there a repair bill? You know, that sort of thing. A lot of this stuff, I mean, there's the policy, and then there's all these little curious wrinkles to individual situations. And so we always refer those on a case-by-case basis, and we would discuss it with the community concerned and agree on a response. I'm afraid, actually, folks, that I'm going to have to leave now, but thanks to all for participating and for the wonderful questions, and thanks to Kiera and the benefit management team for the user guide. I think it's a wonderful document too. So kudos.
Thank you, Paul.
Thank you very much, Paul. There's one more question from Shelley. Paul will note it down, and we'll provide her contact information and ask that we just kind of close the loop with Shelley. So Shelley, I have noted down your question here as well. I think there's some kind of slight permutations or slight differences in your secondary question. We'll get a response out to you by email if that's okay. I think we have time maybe for one or two more questions. Yogi, if you don't mind me jumping in, I do see a question here from Darla. I understand that when we send out children to the BC Children's, they are to stay at the BCFRP. Kiera, hopefully you know what that means. A BC Children's place, I guess.
The BC Family Residency Program, yeah.
Perfect. There was an emergency on the weekend and we were unable to get in touch with the BCFRP. They did not get back to us for 6 days. So is that a question I'm assuming is related to finding alternate arrangements for?
Yeah, so I'll be able to speak to that one. So of course, when BC Family Residency Program accommodations is available, that needs to be used. If the family is choosing alternate accommodations when the Family Residency Program is available, they would not be eligible for coverage through the program. However, there are emergency situations that do sometimes come up. The BC Family Residency Program, I believe their emailing hours is just Monday to Friday. However, in emergency situations, the social workers or the Aboriginal liaison nurses at the hospital really are your best friends, because they can link families to the Family Residency Program. There have been situations where social workers, have told families about Easter seals, which is obviously across the street, and that is used by the residency program. So if the family stays somewhere that is one of the providers through the program, by the time BC Residency kind of opens back up on the Monday, they can essentially take over the booking. There are going to be situations maybe where that's not possible during the summer months, specifically when Vancouver is just chaos trying to get a hotel room. So in certain situations, you may need to provide accommodations in the interim, but that typically should only be for a night or two if the travel falls on the weekend. If you're having trouble again to get through to the residency program via email, reach out to the social worker at the hospital that's working with the family.
Perfect. Thanks, Kiara. I think we have one more question from Tamara.
Yep.
With our ERs closing as much as it does, this eliminates the closest provider for our area, and doctors are moving out of the area, and a lot of clients, myself included, don't have access to a doctor. Will MT support if a doctor accepts a client within a certain number of kilometers? So I think this kind of relates to the closest appropriate provider, if you don't mind answering that one as well, Karen.
Yeah, no problem at all. So so the whole policy surrounding that is the closest appropriate provider, and appropriate there is a key word. So if there is a doctor locally that are not accepting any new patients, that's not an appropriate provider. The client cannot receive care like from them, so they may need to travel to a farther afield. So those are things you might just need to kind of, I mean, we always need to do our little bit of research when it comes to closest appropriate provider, but yeah, sometimes the closest provider may not be the most appropriate, as you said, due to ER closures. If you're aware of those closures and you knew that a person had an emergency appointment at that time, then travel farther afield would have been necessary.
And there are some resources related or provided, I think, through the College of Physicians that helps individuals locate doctors that are accepting new patients, etc. So that might be a resource as well. But if in doubt, please call us at the 855 number or email us at the transportation@fnha.ca. And an assessor would be happy to kind of guide you through the steps in finding the closest appropriate provider for that client's needs. So with that, I think we are out of time. Thank you all very much for taking time out of your busy day to go over some of the changes related to the MT benefit schedule and a guide that we're very proud of, the MT user guide, and hopefully you all find useful as well. I would like to say we are always open to feedback, especially on the MT user guide. It being the first version of that document, we're happy to take any input on things that might make it easier to use, more readable, anything that you think would be helpful for yourself or other PT clerks in delivering their benefits. If you'd like to email us at the transportation@fnha.ca, happy to have any of your feedback or input.